drawing urine. If no impediment has been encountered, the catheter is inserted between 25 and 30 centimeters. Its tip is then in the renal pelvis, and it should promptly begin to emit a constant succession of drops. The first 10 or 15 should be discarded, as these represent bladder content that has been carried up the ureter within the lumen of the catheter. After they have flowed away, a sterile test tube is applied to the outer end of the catheter, and while this is collecting urine from the kidney, the ureter catheter is pushed in 1 or 2 centimeters to give sufficient slack, and the cystoscope is turned to follow the interureteric bar until it reaches the opposite ureter. The second catheter is pushed in, and the second ureter catheterized. With the 2 catheters thus placed in the kidney pelvis, before removing the cystoscope, the rate of flow is contemplated, and if either catheter appears to be delivering urine with abnormal velocity, this is noted, and no further move is made until the flow shall have become more normal. Thus, any retained urine in the renal pelvis is emptied out, and one estimates the amount of retention. But the mere fact of a rapid flow of urine does not of itself prove retention. It may be due to reflex polyuria in a normal kidney. If either one of the ureter catheters has not reached the renal pelvis, the cystoscope will be kept in place until one is satisfied that this catheter is functioning regularly. The catheter in the ureter should emit from 3 to 6 or 8 drops of urine in rapid succession with intervals of from 2 to 10 seconds. If it does not do so, it should be withdrawn a trifle, and if this does not help, an injection of 1 or 2 cc's of water may be made into it. The great objection to this maneuver, however, is that it invalidates one of the few absolute dependable data, urea percent, obtained by the ureter catheter. If one ureter has not been entered at all, the corresponding ureter catheter may be simply introduced into the bladder so as to draw the urine from the uncatheterized side.